Thank you for joining us this morning, and welcome to another Flex University event. My name is Josh Graham, and I'm the sales manager here for Flexible Benefit Service Corporation, and with me, my colleague, Judy Ludden-Gregg. She is also going to be introducing herself for the first time, and today we're really going to be discussing how to sell more with health coverage within the small group SEP. This is a part of the healthcare law that is often overlooked by many brokers, and it continues to surprise us here as a general agency. So we want to make sure that you are aware of this provision and you can use it to your advantage. So just a quick agenda of what we look to cover for the day. Number one, who is Flex? I know we may be new to some of you in the market. We've been around for a long time, and we're going to kind of go through what we do as an organization to support agents' growth. We're going to walk through some of the challenges that we see both on the individual and group markets that we can identify with you, not only for you as a producer, but also your clients, both group and individuals. We'll walk through exactly what this SEP is for small groups, identify some of the knockout questions that may help you be more efficient in this very busy time of year, identifying whether or not you can write some of these smaller groups and really focusing on where the opportunity truly exists. And we'll open it up to questions and answers. All the lines have been muted upon entry. Please feel free to type any of your questions into the questions section of your panel, and we will address those at the end of the presentation. Now, I do have to give a quick disclaimer in regards to the presentation. Each insurance carrier that we represent really has its own unique administrative, documentation, and underwriting requirements necessary for establishing a group health plan. Some of the materials reviewed today can only be discussed in general terms because every situation, as you're probably aware, has some variables within it. Each insurance carrier will make their final determination of an employer's eligibility for establishing a group health plan. Now that we got that out of the way, let's take a quick look at who is Flex. Flex stands for Flexible Benefit Service Corporation. We were founded in 1988. Our headquarters is in Chicago, Illinois, and we have a local office that Judy represents down in Grapevine, Texas. And within our organization, we really have two primary focuses. One is our general agency, which is what we're here discussing today, as well as our benefits administration services that we provide. Now, here's kind of a snapshot of the carriers that we represent in the Texas market for our producers. We really try to build out a well-rounded portfolio of offerings so that you can come to one place and get all of your services, quotes, whatever you need to be successful as an agent. So Blue Cross and Blue Shield of Texas, United Healthcare, Aetna. We have some special programs with Delta Dental and VSP. MetLife, we have an exclusive product with them for the Texas market for small businesses. Right now under 50, as of January 1st of 2018, it'll go up to 100. Very competitively priced, a pretty cool product that you may not be familiar with. Bottom line, reach out to your sales reps and they can obviously help you through any questions you may have. On our GA side, especially for your group products, we have an exclusive platform to assist with collecting information to run your quotes for small groups. And it really is a single source. You can identify what carriers, what effective date, what products, and we'll go to market to all of our different carriers and report back to you with one proposal, or one email with your proposals. This really helps us to improve upon our turnaround times. Obviously, this time of year in the fourth quarter, turnaround times continue to drag out a little bit just based on the sheer volume of business that we encounter. So utilizing some of these online submission tools for quotes can actually help in that turnaround time. So you as an agent can take back control of your time management by utilizing this system. Any of our emails that you'll receive from the sales teams will have videos on the Producer Pad portal, but feel free to check it out right away. That's a great way to start running your quotes and speed up your time management. As a benefits administrator, Flex is able to nationally administer flexible spending accounts, health reimbursement arrangements, health savings accounts, federal COBRA administration, and many other compliance-type services like ERISA wrap document preparation and POP plans. We really try to support all areas of brokers' business, so whether that be in the group market, the individual market, any supplementing type products like these, that's our goal, is to really round out your product portfolio. Our system is going to allow for free debit cards. We have some direct connectivities with almost all the carriers in the industry to facilitate HRA reimbursements. Members have a direct benefits portal as well as a state-of-the-art mobile application to support any day-to-day questions members may have on their accounts that they have with us. Any groups that move to us for these benefits administration services will receive a dedicated implementation rep claims service, and a service staff to answer any questions. Flex is a preferred vendor for Blue Cross and Blue Shield in all of the HCSC states, so that's Blue Cross and Blue Shield of Illinois, Texas, Oklahoma, New Mexico, and Montana, and we are one of those integrated partners on both the group marketplace as well as the retail shopping cart for Blue Cross and Blue Shield HSA products. So if you want to learn more about these items, please visit our website at flexiblebenefit.com. There are a ton of resources for agents on there, including many recorded videos and different tools to support, your sales process. So I'd like to introduce Judy, and I'll let her tell all of you a little bit about herself, and then I'll take back over on the presentation.
Hello and good morning. I'm Judy Logan-Bragg. I'm the Texas Sales Manager for Flex, and I'm pleased to join you this morning. Wanted to tell you a little bit about myself. I'm a Dallas native, born and raised here, and I began my insurance career with Blue Cross and Blue Shield of Texas. I enjoyed 34 years of employment there until retiring in March of this year. And while at Blue Cross, I held a number of positions, including sales, service, operations, and so I believe that this gives me a unique insight into the needs of agents. As you're aware, our industry does continue to experience many changes, and as it evolves, my goal is going to be to work with you to find the best solution to meet your clients' needs. I'm looking forward to a collaborative effort, and my contact information will be shared on a slide towards the end of this presentation, and so please don't hesitate to reach out to me if I can be of any assistance to you. And I'm looking forward to working with you and developing that relationship. Thank you.
Thanks, Judy. So we'll go ahead and jump into some of the challenges that we've identified as a general agency in working with producers that we do nationally. And really one of our biggest challenges is within that individual market. One of the primary issues that we run into are the struggles with accessing the providers and hospitals that members need. Many large PPO networks are no longer available. You've got to pare down into specific ACO type relationships in order to access certain hospitals. And then if you need to change hospitals, you run into issues until next year's open enrollment. So definitely a lot of challenges for you as brokers that we've also identified as a general agent. And really, there's additional questions like carrier options that the clients are going to have access to. What's going to actually work for them? How are the rates going to compare to last year? Obviously, we've seen some pretty significant increases for certain carriers. And then commissions always become a question in order to control cost. So these are some pretty significant challenges that we deal with in the individual market that I think will help with identifying a need and talking through a little bit later about the SEP period for small groups. Now, when we look at the actual consumer's needs, does affordable coverage really exist? That's one of the biggest challenges right now in being able to not only afford the premiums, but any out-of-pockets that would ensue with the products that are purchased. Am I able to find someone that's actually willing to help me with these individual policy sales? We're of the opinion that we've got a lot of great agents that are supporting people out in the field, but there are people that are diversifying their book of business and moving towards, either Medicare or potentially towards the group policy sales. So for consumers, that becomes more of a challenge if they don't have access to group products. And then in addition to that, there's obviously concerns about some of the tax breaks that are made available to these individuals. As of now, the advanced premium tax credits are still going to be available, but right now the cost sharing reduction subsidies are in question. Could get built back into a bill, but that becomes a challenge for people when you start looking at what it's going to cost you. It does sound like some of the premium credits will be substantial based on some of the changes. However, if you still have a $7,000 out of pocket, for many that's unaffordable. So a lot of challenges in that market that we may not see necessarily on the group side. And looking at our producers' needs, obviously being able to identify additional prospects, how to go after those prospects, and some different strategies. Our agency helps prepare different marketing classes and to support agents' growth in that perspective to get you to those individuals and help you to get to the finalist presentations. Where you can actually find support if you're newly getting into that group market space, feel free to reach out to Judy, obviously, and any of the individuals here in our office, but we can really help with getting up and running within the group market if you're not already there. Different ways to create efficiencies become a challenge for many agencies, really looking at different electronic platforms and things that make your day-to-day business easier so that you can remain on the street and continue to sell. Competitors definitely new competitors coming into the market, many on a digital platform that you need to keep up with, so it's important to note that. And then the ever-changing issues that we run into with compliance and an employer mandate and individual mandate, and having all the different documents on file for your clients and when to send those documents, all this starts to become a very full-time job. So now that we've talked about all that good news, let's take a look at what the great news is here with the small group SEP. And like I mentioned, there are a lot of agents in the market that really don't realize that this is an option for them, and it is a special time of the year, a time of year that started back in 2014, since this has happened every year since the ACA has begun. I mean, it's continued to pick up steam, but we've had a lot of agents that have been very successful marketing specifically towards this provision within the healthcare law. And what it does is it basically is a time period in which the carriers are told that they are unable to decline to write a group based on poor participation or lack of contributions from an employer. And really what that tells me is this is the first time that we are actually able to sell a fully insured small group product on a voluntary basis and not even having to contribute. It is a very unique time of the year. It is a small window in which we're able to take advantage of this time of year. So to take a look at that, this special enrollment period is going to run between November 15th through December 15th. That is the universal time period. Some carriers have decided to open it up early. What's the harm in getting business in earlier? For all of us, we would agree. So Blue Cross and Blue Shield of Texas in particular has extended that special enrollment period from November 1st through December 15th. Now, all of this is for effective dates of January 2018. Regardless of the carrier, your policies have to go in place January 1 to take advantage of this provision, and everything must be submitted into us as the general agent between that time period. So if you submit a case on December 16th and we're not meeting participation, we are not going to be able to write that group for January 1st. So it's very important that we're working to identify groups ahead of time that would need to take advantage of some of these changes and the provisions within the SEP. Try to get those into us first prior to working with other clients that may already be contributing to their health plan well, and obviously in return then probably meeting participation. So this SEP is very unique, and I can tell you that, like I mentioned, many brokers are unaware of its existence. So the question becomes, how do we really take advantage of this time period? I would recommend that you immediately begin prospecting towards any individual clients that are still in the market. Many of them are business owners and have the ability to potentially create a group plan. Obviously, prospecting to any small businesses in your area, the majority of the small businesses out there do not offer group coverage. Many reasons is because they couldn't meet participation, they couldn't afford it, and that's where this SEP really becomes advantageous to you as a broker, as a sales tactic, because the employer does not have to contribute to the plan. And if they only get one person enrolled out of all their W-2 employees, you could still get that policy off the ground, and you didn't waste your time as an agent. Here at Flex, we actually created a template letter that you can put on your own company letterhead and brand however you want. But what it is a prospecting tool that is something you can give to your individual clients that they can take to their own employer. Obviously, if they have an individual policy, they most likely don't have access to a group policy, and therefore this letter is drafted to an employer to talk about all of the benefits of this special enrollment period, not only to the employee but also to the employer. So things such as access to a large PPO network, the ability for employees to pre-tax their premiums through a premium-only plan, obviously creating tax savings for that employer as well. Not to mention improving the overall retention of those employees. They already know that they can't get access to group policy networks on the individual market. So having access to that policy is going to help with the overall retention within your employee population. So this letter is really laid out to identify all of those pros with offering a plan during this SEP period for groups that currently are without coverage. And then the one thing I would mention to all agents, and this comes up very often for us as a GA, is that you really should not forget about talking about these ancillary coverages. Whether or not that employer is paying for it or not, we can offer voluntary lines, especially when it's packaged with medical. And I can tell you that there are agencies out there that will literally try to market ancillary only to get in the back door to go after new business. So if you're not talking about it, potentially someone else is, and that can create some issues for you on your retention with potential clients. So really cool period of time. Start talking about it now. Reach out to Judy or myself, and we can send you over a copy of the letter template to start marketing right away. Now, when you start talking to some of these small businesses, when they have 1 employee, 2 employees, it becomes confusing. And I'd be the first one to tell you, starting out my career, focusing with businesses that are less than 10 total employees, writing these 1 to 2 life groups is harder than writing a 40 life group. And because of the sheer volume of small businesses out there, you got to be good at identifying really what groups to focus your efforts on. So I want to go through a couple of knockout questions that may support your efficiencies in identifying these prospects, because really, as I mentioned here, time is not on your side. And these questions will help weed out those good groups versus your bad groups. And the number one thing that we'll probably always ask for as agents is whether or not you have a Texas Workforce Commission Employers Quarterly Report available. This report is something that is filed on a quarterly basis for any employees that were paid for tax purposes. We took a couple of snapshots from that particular form, the C3 form that's available. I know most of that's done electronically, but employers can report on this. And we'll point out 3 items that's on this employer's quarterly report. The top item, you'll see it's kind of a grainy picture, but it identifies the quarter that you are going to be filing this for. And that's important because the carrier is always going to be looking for the most recent quarterly report. The second line is going to show you the number of W-2s that are issued, and this is very important as we start to talk about whether or not you are going to meet the group eligibility requirements. You'll see it mentioned month 1, month 2, month 3. For example, if this was a first quarterly report, you'd see your first month being January, second month being February, and third month being March. And what we need to typically show is that you're going to average a number of W-2s over that particular year. And then the bottom section of this particular form is going to identify all of the employees that have been paid a wage over that quarter, because that's what happens when the employers are filing for those taxes. So with the employees listed there, that's where you'll need to identify who's full-time or part-time, potentially seasonal. Some employees may no longer be with the organization. We identify them as termed. We may only be writing a non-union part of the group as opposed to a union group, and therefore we're going to carve out anyone that's listed as union. So really submitting a clean case will really be tied back to this quarterly report and making sure that we identify status of all of the employees that are currently employed under that group. So that's the first thing we look for, and here's the reason why. You got to look at this as a way to, like I said, weed out some of the groups that won't qualify. But when you're speaking with a business owner, one of the things you want to identify is, well, are there any employees besides yourself? Employees being any W-2 wage earners. And if the answer is no, you got to move on, because you're most likely not going to have a shot at writing that group. Now, we'll talk about some exceptions here in just a second, but that's the first thing you want to look for. Are there any W-2 employees? Now, for Texas, a spouse could actually qualify. We'll talk about that a little bit later in the husband and wife groups category. For any children that are working for the business, this is very common. They would qualify as a W-2. And then in some circumstances, carriers don't even care if that employee is benefit eligible. So that's really important to keep in mind, because potentially a part-time employee on payroll could suffice for your group eligibility requirement. It's also important to look at how they're determining whether or not you meet this group eligibility. So one of the primary questions on many of the employer applications when you're completing a new group is whether or not you had 1 employee on average for most business days in the prior calendar year. Prior calendar year, what does that mean for us if we're writing an SEP case for a 1/1 effective date? That means that you needed to average 1 W-2 for all of 2017. Obviously there's some gray area there, and we can work with underwriting for exceptions depending on the carrier, but really we need to show that there were W-2s in the previous calendar year. A couple of exceptions that I mentioned, if someone mentions, well, unfortunately I don't have any W-2s available, there generally is no requirement to have a W-2 if you're one of the following corporations. Really, we're identifying partnerships here. So if you're a limited liability partnership, a limited partnership, and then in some circumstances, limited liability corporations, your LLCs, As you may be aware, LLCs can file taxes as either a business entity or as a partnership. So it's important to take a look at prior carrier tax documents to determine what type of organizational type it is and how they're filing their taxes, because that will drive your recommendation as an agent. So the form that underwriting is going to be looking for in a circumstance for an LLC where you have partners, and it is filing as a true partnership because that is what Blue Cross and many carriers will look for when they're trying to write these smaller cases, you got to identify a 1065 K1. A 1065 is an actual partnership K1. You may be familiar with other types of K1s like an 1120S. That's for shareholders within a corporation. But the specific format, if you're not going to have any W-2 employees, is a 1065 K1 for an LLC, and that's important to note. Everything I mentioned, as soon as you have W-2 employees, all this goes away because you are going to pass the eligible group test. But if you don't have them, you got to ask a couple of additional questions, as we mentioned here. Now, there are additional exceptions on newly incorporated businesses. So if you were a new business and you literally just organized this year, you're obviously not going to be able to answer the question in the previous calendar year, did I have any W-2s? In turn, this is going to change, and they're going to ask you, how many W-2s do you expect to employ for the remainder of this business year? And as long as you can tell them that you're going to have one W-2, you can generally get these group plans off the ground. Now, one of the challenges that we run into with new businesses is typically you don't have that quarterly wage statement. And so what the carriers will look for is some additional information. They want to prove that it's a true business, it's up and running and established. And one way to do that is to identify the articles of incorporation or potentially the articles of organization, depending on your business type. The certificate of organization that's issued by the Secretary of State of Texas. Your IRS form SS4, that is when you file for your tax ID as a business. It will tell you what forms you must file upon tax season, so that helps support this is a legitimate business. And then also the easiest way to make sure that we're meeting participation outside of an SEP would be to provide a listing of all of the full-time eligible employees that are working for the organization. So all those things will help in lieu of that wage report. So looking at some additional knockout questions for a newly organized business, as I mentioned, we're no longer looking at an average from last year. We're looking for the expected average for the remainder of the year, and that's important. You will need to provide payroll to prove that this is an actual W-2 employee. When we say payroll, it's got to be some kind of report that shows taxes held on the federal level and things like that. So you got to have that available to prove that it's an employee. But it becomes a lot easier, and this is interesting because we're seeing groups actually incorporate for the specific need to get access to health insurance coverage. They're willing to pay to set up a business just to get access. And I've seen this even as a last resort. We've had cases in previous years that have gone through the entire process of submitting for underwriting only to get a decline because they didn't have employees in the previous year. And then straightforward with the underwriter, setting a brand new business up, resubmitting a month later, and being able to set that group policy up because at that point they are a new business and they are going to be meeting the group eligibility requirements. So, all I can say about that is that it's a very interesting time. There are individuals and businesses out there that are desperate for access to these health insurance policies, the networks that are available within the group market, and really focusing during this SEP period, which is going on right now for Blue Cross and Blue Shield, begin very soon with other carriers starting November 15th. Utilize this as a sales strategy for yourself moving forward, and I really think that you will be successful entering into this group market space if you're not already working in that area. So I'd like to go ahead and open this up for any questions or comments that you may have. And also note Judy's contact information. If you want to get in touch with her after this presentation, please do. She'd love to help you out with any questions and support your growth as an agent within our market. If you're interested in learning more about our consumer-driven accounts like flexible spending accounts, health reimbursement arrangements, we're of the opinion that every client needs to have some type of tax vehicle to support those out-of-pocket costs that are coming up. Feel free to reach out to us. We have a dedicated sales rep for those particular products that can answer any questions that you may have. As I mentioned, you can visit our website at flexiblebenefit.com. There you'll find a ton of resources for brokers, posted videos that can help you training some of the products we represent. There's a lot available to you as agents. We really want to create these on-demand type videos to support your growth. We know time is valuable. A lot of times you don't have time to sit on webinars like this, and catching up later in the day is easier via video. So we try to make all those available for you as agents. Feel free to follow us. We have a blog with Flex that really goes through all the different updates that you'll see throughout the country and things that you should be aware of as brokers. You know, a lot of times we'll get really confusing questions and we have to go research them, and we actually turn those into a blog because we find that many brokers have the same questions and may just not ask them. So feel free to check that out on our website and follow us on any other social medias there that you see. You know, what I would do is just kind of reference you back to our website. If you do have any additional questions, reach out to Judy for any of your sales-related questions. You know, at Flex, we have a full dedicated service team to support you with any cases that are written through our organization. We're always trying to drive different technology options to support your efficiencies as a broker and compete, obviously, with some of those other you know, electronic vendors that are entering the market. So please stay in touch with us. Please let us know what we can do to support your growth as an agent. Thank you for attending, and we really look forward to working with you here during the busiest time of the year. Good luck to everyone on your open enrollment, and we'll talk to you soon.